Let's get to the real questions here. Doctor, sir, is a scientist. Am I correct?
Oh, yes, very much so.
All right. What is your position on Pluto being reinstated as a planet, as a scientist?
You know, it's more of a Star Trek fan, to tell you the truth, but it seems to me if you're going to take a Enterprise out around Pluto, wouldn't it be more fun if it was called a planet?
Thank
Why
you.
not?
Thank you.
You know?
Thank you. Hey, welcome into Carpooling with Ben, ladies and gentlemen. He's been on TV over the past year more than Noah Wiley has been, the former ER doctor. He is also a doctor. He is Dr. James McDonald of the Rhode Island Department of Health. Sir, good to see you.
Ben, it's great to see you as well. And, you know, it's honored to be in the same reference as Noah Wiley.
Well,
we look so much alike.
I will talk a little bit later about TV characters because I've got some questions for you, the hard-hitting questions on that as well. Before we talk about the vaccine, which is what we're talking about today, for people who don't know, because they've seen you on stage, they've seen you, giving all this information over the past year, which has been just amazing, and hats off to you and the entire crew over there at Rhode Island Department of Health. What is your background? Where did you go to school? How did you become a doctor? How'd you get into the field?
Yeah, so I grew up in upstate New York, a little town near Albany called Cohoes. So that was home. Made my way into the world, though, and I think part of because of the Navy. I was in the Navy, paid for medical school, Ben.
Yeah.
And they got
Beautiful
me
thing.
to Oakland, California for my internship, Bethesda, Maryland for the Navy hospital. I went to Okinawa, Japan. Anyways, after 6-7 years in the Navy, it wasn't because of anything more than just like, there wasn't a war going on. It was relative peace. I said, thanks for the memories. They said, great having you. And then I went out and did my thing in the world. Been in private practice in Pennsylvania, worked on the Navajo reservation in Chinle, Arizona for a couple of years. And then came back, did a preventive medicine residency because as a pediatrician, I kind of realized, I really want to learn how to prevent disease and really wanted to get into public health. And then it was the Department of Defense that brought me back to Rhode Island. Where I did some time there. And then I've been here at the Department of Health since 2008, early 2008. So I very much enjoy it. I live in North Kingstown with my wife, 3 kids, 2 dogs. A lot of fun we have down here in North Kingstown. We do.
I'm sure they keep you all busy. And of course, we've heard your references. And, I think people, early on in the pandemic really started to connect with you when you started bringing those little object lessons where you were talking about, perhaps the items that are shared in the home and just transmission. And I think that got people thinking in a different manner. I mean, obviously the information of wearing a mask, washing your hands, the social distance, all those messages were clear and, coming through on a regular basis, but you took it to the next level. And I don't just mean to single you out. I think any doctor with your level of creativity and everybody really started seeing that, but you really did such a great way of bringing it to life. I don't know if you realize this, but you have been kind of referred to as the Mr. Rogers of Rhode Island. With your way about you. Do you often change your shoes when you come into the house and toss them and put a zip up sweater when you come in? Is that part of the routine or no?
Yeah, it's funny. It's more sweaters I change throughout the day. And I have to just say this is sort of a funny thing is I do a fair number of media appearances throughout the day. But one of the things I will do throughout the day, especially since I'm at home, is I actually don't wear the same sweater or tie even if I'm doing back to back. I do quick changes because I realize people in the media, you don't want to look like the guy who's just going from channel to channel. So that's something I do. And it's funny, you talk about references of things I brought during press conferences. It's funny. I had no idea bringing a tube of toothpaste would change my life one day. But it's funny when I talk about this to people, it's really funny. It's the day I brought toothpaste as a common object that really people were like, they just couldn't get over that. And I thought it was so natural, but it's funny, like, one of the things that people wondered is, does the governor know what I'm doing before I do things? And the answer is no, she has no idea what I'm doing before I do things. So she was genuinely surprised every time I did something. And quite frankly, it was not anything more than just, I didn't really think anyone cared to know. And no one asked. And quite frankly, as I kept going and going, they still kept not asking. So even to this day, the last time I appeared with the governor, I think I brought a KN95 and reminding people to upgrade their mask. And after the press conference, she said, that's a really good idea. We should be telling people that because part of it is just me being me.
Yeah. Well, that's why I think everybody has taken such an affection towards you, as far as, you're the kind of person that we'd welcome into our home for dinner, or, and that's a thing that a lot of people in the TV industry, it's like, okay, you're bringing us into your home on a regular basis, whether they're a news reporter or something, and you, not necessarily the role you want to be in when you're a doctor is, dealing and navigating through a pandemic, but you and the fine folks there, you've all done it just a great job with it. um so you talked about, you went through the medical school, through the Navy and everything. How old were you when you decided you wanted to become a doctor?
Yeah, it was 19.
You
And
were
I know it
19.
was 19. And the reason I know it was 19 was my first major in college was photography. And I had gone from photo illustration to medical photography. And I remember one day I was walking into the bathroom getting ready to go to another photography class. And I said to myself, gosh, if I ever have kids, I'm just going to encourage them to do whatever they want to do in life, to explore whatever they want to do. Because I hate this. I hate being a photographer. And I looked in the mirror and I said to myself, I'm 19 years old. Everyone has discouraged me from being a doctor because they said it was too hard to get into. And no one in my family was a doctor. I said, but you know what? I will probably fail, but I'm going to go try to be a doctor the very best I could be. And even if I fail, at least I'll have known I've tried my best. But I just can't keep doing this. And it's kind of funny because, Ben, everybody's now a photographer. So
Sure.
it's great that I didn't do that. What's kind of funny though is the family business was pharmacy and still very much is in upstate New York. What's kind of intriguing though is, when people used to ask me in medical school, what kind of doctor do I want to be? I would say the same thing. I said, I want to be a good one. Because I didn't know, I wanted to be a pediatrician or go to public health. I just said, I want to be a good one. And I think it's because I approached studying medicine from a very honest approach, which was I just wanted to help people. That's all I want to do is help people. I had, no other ulterior motive. And it's funny, Ben, I'll tell you this story. I have never told anyone else. When I took my first job outside the Navy in private practice, it was in Pennsylvania, and they were recruiting me. I was recruiting them, but they always were trying to talk about salary. I said, salary doesn't matter to me. And I never knew how much they were going to pay me till the day I started work, because I said, it's so irrelevant to me what you will pay me, because that really wasn't important to me. And the day I signed my contract was the first time I saw what they're going to pay me. And it was a fair amount for back in the early 90s. The point being was that it was never finances that drove me, and finances still to this day don't drive me, because it just doesn't matter when you think about it. Like when you have what you have in this life to offer, it's the memories you will keep that will be of great riches to you, and the treasures that we'll have, and the relationships are the treasures. But those material things don't really matter all that much.
Wow, that's very poignant. I mean, that's such a noble way of getting in. I mean, yes, there's the Hippocratic Oath and to none do harm, but to take it to that next level, as you've just described, that's truly incredible. Let's talk about why you're here. We are talking about the COVID-19 vaccine. I don't know if you can see it, but I am holding up my card. It's got two markings on it, good sir, and I feel wonderful. It's As a firefighter, I was able to get it as a first responder, but this is starting to come out, and every day, we're making more and more progress. We're seeing more and more doses. And I made this reference at one point to somebody. I said, "Listen, 2 weeks now is a much different measure than it was 2 weeks in March and 2 weeks in April. 2 weeks now is really, we have some strong efforts going here, not only through the vaccine, but also the various therapies. Talk to me just about the vaccine, in brief. I mean, look, you could go online and read all these stories and all these reports and everything, but the peace of mind that people are really looking for when it comes to the vaccine is what?
Yeah, and I think about it this way. Our first case in Rhode Island was February 28th, 2020. And if I had said to you on February 28th, 2020, look, it's going to be till July of 21, but by July of 21, everybody's going to have a vaccine, whoever ever would want one. I think most everybody would have said, I'll sign up for that bargain. I'll take that. And I'll say, by the way, it was a safe and effective vaccine. Everybody be like, okay, I'm on board with that. So that's where we are, though. And I'm extremely grateful. We have two vaccines that are safe and effective. I think we're going to have a third one this month that's also going to be safe and effective. So I'm pretty happy about that as well. I think one of the things people are struggling with is, why do some people get the vaccine before other people? And I think that's a common place that people struggle, because we grew up with that, right? In other words, one of the things we grew up with in our country is you get in line, and then you get everybody goes next. And we didn't do it that way. And the reason we didn't do it that way is because we really have a couple overarching goals. So one overarching goal is we really want to reduce the number of people who die from this disease. I think everybody get their arms around that. It's like, look, we just don't want people to die from this disease anymore. We really want to get the mortality rate below influenza. Right now, our mortality rate right now is about 1.3%. It's down from even about a month ago when it was 1.7%, and then down from April when it was 10%. So the mortality rate's heading in the right direction. The second thing we really need to do is keep people out of the hospital. And that's a really important measure as well. So first, we want to reduce people from dying. Second thing we do is keep people at the hospital. Why is that important? Well, because we need our hospitals to do what hospitals were always doing. And by the way, before the pandemic, our hospitals were generally pretty busy. Right now, we have 2 field hospitals open. We'd rather have no field hospitals open.
Sure.
So that's the second thing. The third thing we really want to do is we want to open our economy back to normal as quick as possible. So the quickest way to do that is prioritize the highest risk individuals. And the highest risk individuals were people who live in nursing homes, people who are 75 and older. So that's where we started. But we had to include healthcare workers and first responders. Well, why do we do that? Because if we don't include healthcare workers, you don't have people who will work in the hospitals. You don't have people take care of the sick people. Your mortality rate goes up, and that's terrible. Why first responders? Well, it turns out we need them. You know, if the building's burning, you got to get someone to put the fire out. If there's crime happening, get someone has to stop it, right? Makes sense, right?
Yeah.
And so part of it is, and I view it somewhat simplistically, but I think if we think of it in that terms, it gets to a different way of looking at it. It's, you know, like Ben, I have 3 kids. I love them all the same. I do not have a favorite. And part of my point is I do what's best for each child as their life goes on. And like when it came to education, we had 3 different kids with 3 different educational goals, 3 different, it worked out, right? But the point is, when I think of my kids, I love them all the same. When I think of the 1 million plus patients I have in Rhode Island, I love them all the same. I'm trying to protect all of them. But the best way to protect all of them is to decrease the fatality rate, keep people out of their hospitals. And by the way, make sure you have the people you need in your neighborhood to take care of you, which is the healthcare workers and your first responders. And if we do it those 3 things, then as we unfold more vaccine to more people more quickly, it'll make sense to people. And we'll get to where we need to get to, which is everybody getting a vaccine who wants one by July. And I do think next month you're going to see, like come March, there's going to be a lot more vaccine availability is what I'm hearing from the federal government. So I think we might even see March and April, a lot more vaccine availability, which should allow us to open up to even more people.
The other factor that, you know, I know people have kind of may not have been aware of is the handling and the logistical situation that you have to deal with. It's not just here you go, just run with the ball. I mean, there's a lot of you know, a lot of details, a lot of logistics and planning that go into it. So for your team and the vaccine team, I think it's Dr. Chan who's kind of heading that up. Like just to pull all those individual factors together on all these variables, and then to be able to say, okay, we need to quick respond, like literally within an hour or 2. I've got 5 doses left in this one vial. I have to, they're either going into an arm or we can't, you know, you can't put it back with the butter, you know? So how do we have those systems set up? And I think now that over the past week, as we've started to see the easy roll up, the slow warm up with the various towns and cities, and how they're able to use these smaller amounts before they get to the crazy amounts, the bigger amounts, I should say. That's been very impressive. And just, I mean, it's something else. What you got the vaccine as a medical professional? Did you go Moderna or Pfizer?
So I got the Moderna vaccine, and actually the reason I got it was because I'm actually a doctor who sees patients. And it was really because I see patients in Connecticut on Fridays.
Okay.
So it was actually, I got 2 Connecticut doses. So I just say that. But, you know, and the Moderna vaccine worked well for me. I had a sore arm a couple of days, but big deal. When I got the second dose, it's kind of, you know, one of those things where I woke up the next day feeling pretty good, but then I had a little bit of like achiness. And because I had something special going on, we're celebrating my son's birthday, and I didn't want to be achy.
Yeah.
I took Tylenol and I was fine. And then about 6 hours later, I was really completely back to normal. So pretty uneventful reactions to me. It worked pretty well as far as I'm concerned. And it was interesting. I was actually at the Saconaset site last night where the Rhode Island National Guard's giving vaccine to healthcare providers. And my wife's an audiologist, so she's a licensed healthcare provider, a little bit like me. She's at the age where we are a little bit higher risk. So she got her vaccine last night, but I got a chance to walk around the Sauconnessett site. Captain Barrett gave me a lovely tour for the National Guard. And it really was a well-run site. It's just orderly, but it gets the logistics you talked about, which is that everybody has to be 6 feet apart. You have to have people have appointments so you know when they're coming, so you don't have a mass of people all at once. And then you have to move people through orderly all the time. And then you have to have them wait for 15 minutes. And that's infrastructure. And when you read infrastructure, it's really about planning. And if anything runs well, it's because there was a lot of planning from our team to get it to go well. And the National Guard did a great job planning it. They did a great job implementing it, and they're doing that. And, it's interesting, like even this Saturday coming up, they're going to be doing 3 times as many people per hour as they were doing today, just to start maxing out their system to see how quick they can go and do it safely. And I think this just speaks to what you're going to see is as people get more familiar with their point of distribution events, their pods, they're going to get more efficient so we can get much more people done, because we really have to get 1 million people vaccinated. That's my goal, at least.
Right. Well, it's certainly something you're moving fast and furious towards. As fast as they come in, you folks are getting them out, and we'll see those amounts come up. My reaction to the second shot, I spiked a little bit of a fever. I was a little achy afterwards because you shiver and everything. You don't realize you use those muscles when you shiver. But aside from that, it was great. It was fine. And just the site where they hit the injection was a little tender around there, but that's okay. It was great. And from everything I'm seeing, the folks that are getting them, whether they're young like yourself, a young 24-year-old like yourself, or a person a little older, everybody seems to be doing just fine. So let's get to the real questions here. Doctor, sir, is a scientist. Am I correct?
Oh, yes, very much so.
All right. What is your position on Pluto being reinstated as a planet, as a scientist?
It's more of a Star Trek fan, to tell you the truth, but it seems to me if you're going to take a Enterprise out around Pluto, wouldn't it be more fun if it was called a planet?
Thank
Why
you.
not?
Thank you.
You know?
Thank you. I mean, everything. Just you're going for NASA next. Now that I have the COVID vaccine, is it safe for me to eat raw cookie dough?
Oh, yeah, as long as there's not a whole lot of egg in it. That's where I'd be a little bit careful. If you
Okay.
have raw egg in it, I'd be careful.
All right.
And that's where it's like, be careful, guys.
I was thinking that the other day. I'm like, I might be invincible. I'm going to have to ask the doctor.
Well, it is something people feel, though. After they get the vaccine, they all of a sudden feel like, hey, guess what I can do? And the answer is, don't put the superhero tights on just yet, because it turns out after you've got the vaccine, you're really not that different.
Yeah, it's no, you're absolutely right. Getting the vaccine does not change the fact that still the washing the hands, wearing the mask, the social distancing for the time being. We still need to keep those efforts in play for a little while longer and making it through there. So good advice there. Do you watch? I mean, I know you haven't had a lot of time recently, but do you ever watch like the doctor shows or the hospital shows? And do you ever watch them and like judge them and be like, nah, that's not right. Nah, that's not really true.
Yeah, well, therein lies why I don't watch the doctor shows, because it's really like this. I don't watch TV to be irritated. I watch TV to be entertained.
Yeah.
So it's far more likely I'm going to watch Star Wars or Star Trek with my kids, or The Office, which is we just finished watching The Office again because Christopher loves The Office.
Yeah.
Because stuff like that just doesn't irritate me at all.
No, that's good. That's great. I like that. If you could break any world record in the world, obviously, any world record, if you could break any world record, which one would it be and why?
Well, it probably would being able to run fast, because that would mean I would have lost all this weight and I would feel that good that I could sprint again. Because that was something I used to do in high school. I could actually sprint. I wasn't that great at it because I was short, but it was still something I used to be able to do that really quickly. So it's like, I miss being able to sprint. I really do.
You brought that up not that long ago that you ran a marathon.
I know.
You have completed a marathon, which is impressive. I drove a marathon once.
It's beautiful. Yeah. I did mine in Japan. Like when I was in Okinawa, Japan, in the Navy. Keep in mind, this was 1993 to 1995. There was one TV station. If I wanted to get on the internet, it was 20 cents a minute.
Wow.
And I was working as a doctor, but it was a beautiful tropical island and I had a lot of free time. And so I had time to go running, but it was common when I was in Okinawa to run 3 times a day. and there was just nothing else to do, really, quite frankly, and
Sure.
go hiking. So I was in great shape.
Hey, you know what? But you look great now. You still look great, and I don't ever let anybody tell you any different. You look great to me. Doc, I want to just thank you so much for all your support and the teams over there at Rhode Island Department of Health. I know they're going through a lot, and any advice that you could offer to folks as it's now the waiting game, which is gonna pick up speed.
Yeah, the main thing you can do right now, and I think my big message for anyone today who will listen is upgrade your mask. So if you're someone who's been walking around with a cloth mask, like I happen to have, this is just an N95 I got on Amazon, and I've got a little KN95 over here that I got too.
Yep.
You can upgrade your mask. That's one thing you could do. When I think about the variant that we worry about, the risk that's rising in the United States, if people upgrade their mask to one of those high quality masks, you're not just doing source control, protecting others from you, but you're protecting yourself from others. So upgrade your mask and do it today.
There you go. Dr. McDonald, it was great chatting with you, and I wish you all the best. It was great to meet you. And, once everything's done with this whole thing, we can get in vehicles again. You're more than welcome to hop in the car. We can drive around, sing some karaoke or something. I don't know, maybe go get ice cream. Your choice. Your choice will be my treat. We'll go.
We'll do ice cream. I love it. Let's plan on that.
That's a beautiful thing. Dr. McDonald, thank you so much.
Thank you.